Diabetes is a major problem in the state of Louisiana. It's a major problem in the United States of America. And there are a lot of great programs going on in Louisiana that are trying to address this growing problem of diabetes. But a lot of times the left hand doesn't know what the right hand is doing, and they're all good, well-intentioned folks doing things to try to improve the health and productivity, reduce cost, etc. around diabetes. But I just felt if we had an integrated approach where we brought all the stakeholders together and we started talking about how we could work together in a much more coherent and cohesive and coordinated fashion that develops an integrated statewide approach to dealing with this disease, it would really be a very, very good thing for the state of Louisiana.
There is no bigger problem that's facing our state in terms of health care than those with chronic disease. Diabetes is one of the principal chronic diseases that we're facing. Today, payers and providers, researchers and doers are all getting together to talk about a strategy that we can execute in our state to make people healthier, prevent diabetes, and treat those that have it.
Blue Cross Blue Shield and Merck are having a Tackling Diabetes Summit, and the Quality Forum is going to play, I hope, a very critical role in this. Two ways that I think will play an important role is through our the Health Information Exchange, which we launched this past Friday, which is the opportunity for clinical data to be accessible to the provider at the point of care. And the other is that we're in the process of developing an all-payer claims database, which combined with clinical data will be an invaluable resource to providers and provide population health information.
The message is whether it's preventing or treating diabetes, it doesn't take that much when it comes to diet and physical activity. Small changes in diet, small changes in physical activity, tremendous health benefits in individuals with diabetes and individuals without diabetes.
I'd like to announce our starting lineup for today's events. We're going to have each speaker come over here and pick up their Tackling Diabetes t-shirt and put it on, take their jacket off and put it on over their shirt and tie. So we have first the Secretary of Health and Hospitals, Bruce Greenstein. Second, we have from the Pennington Research Institute, Dr. Timothy Church. Next, from the Center for Health Value Innovation, we have Cindy Nair. Also, from the Center for Health Value Innovation, Dr. Jack Mahoney. From the Louisiana Healthcare Quality Forum, we have a local here, Cindy Munn. Another local who's just come here in the last few months from the Louisiana Public Health Institute, Nabiyu Abede. And last but not least, myself. Good morning, sports fans, and welcome to the epic battle pitting the state of Louisiana against one of our #1 health problems, diabetes. We won the game of the century Saturday night, so let's keep that streak going and improve the health status of Louisiana and move up the rankings by working together to tackle diabetes. We don't need the Mad Hatter, Les Miles, to tell us that we need a few new game plans against this very formidable opponent, diabetes. We need to turn the playbook page, dial up some new plays, and develop a strategy that defeats diabetes in Louisiana. Today, we have assembled an all-star starting lineup of community, state, and national leaders to help us understand the scope of the diabetes problem and how we can develop a statewide initiative powered by each and every one of you in the audience today and getting together, working very diligently, coherently, in a very comprehensive, integrated fashion to tackle diabetes. I'll go to the next slide. Everybody, I think, in this audience knows that diabetes is a major issue facing not only the state of Louisiana, but the entire country. The data up on the slide show how in a short period of 10 years, our obesity prevalence has significantly increased. Back in '98, we had probably half of the country was at 18% or less, and now just 10 years later, majority of the country is at 26% or more. And following right along the heels of the obesity epidemic is this burgeoning diabetes problem that we're facing not only in Louisiana but throughout the entire country. And you can see again, the numbers have significantly increased in a short period of time. It's a growing problem in our country. I'm going to put up some statistics here. The thing I find most disturbing is that not only we have almost 9% of Americans that have diabetes, 27% of Americans have diabetes and they aren't even aware of it. Another 35% of Americans over the age of 20 have prediabetes or metabolic syndrome. Are you okay with that? No. That's right, no. 2 million new diabetes cases diagnosed annually. This is the most scary thing to me, not only as a physician, but as a citizen of this country. If we don't do something to change these trends, in less than 40 or 50 years, 1 in every 3 Americans are going to have diabetes. Not pre-diabetes, not metabolic syndrome, but full-on frank diabetes. Are you okay with that? We need to do something different. This is also a very scary statistic. For the first time in history, we are seeing kids under the age of 8 years old showing up in the physician's office being diagnosed with adult onset diabetes. Are we okay with that? This is a highly prevalent disease, and it's easily treated. But less than 10% of Americans are being treated effectively. Are we okay with that? We have to do something different. I think the mantra going forward for all the people in this audience is no undiagnosed diabetics in the state of Louisiana. No undiagnosed diabetics in the state of Louisiana. Say it after me.
We really want to slow the production of this disease, reduce risk factors, get people engaged in their own health, and we can do it at the work site. We can do it, through individual websites. There's going to be a talk about text for diabetes, where you can actually get information on your smartphone. We have to think outside of the box. We have to think differently about this and apply all this great technology that's now available in our country. So once we can find those people and engage them, activate them, educate them, they can start to take better control of their own lives, their own health.
We care about people's health. We want people to be healthier, have a higher quality of life, be more productive in jobs. The other is the costs associated with diabetes is crippling to our healthcare system. It's also related to other expenses and shorter life expectancy. We need to handle both of these problems together. Today I get to talk about actual health and healthcare instead of budget and regulatory issues. About 2 weeks ago, we did a dental clinic at a school in North Baton Rouge. And we had maybe 400 kids in the room, and we did a program, and I had them all chanting, what are they going to do? Brush your teeth, read a book, exercise outside. It was great. And at the end, I did a television interview. And while I was talking on the mic, about an 8-year-old kid just put his arm around me, and he was stuck at my side. And we walked around, and I was on the, on TV, so I couldn't, say, hey, what's going on with this kid? And so afterwards, I introduced myself. He told me his name, and he said, well, what do you do? What's health secretary? And I said, well, it's a big job. We regulate and pay doctors and hospitals and dentists. We inspect restaurants to make sure that it's clean and you could eat food there safely. We prepare the healthcare system in case there's a hurricane. And he's like, what are you doing tomorrow? And you know, there is something about that that made me think that there is no way we can slow down in what we do to try to bring our state from where we're at today, which I'll go over, everyone hears me say it all the time, 49th place in the country, to be almost last to being about the best. And I know that it's something that, just given the energy here today, listening to Ken, I know that there's a potential to do that. Let me take you through a little bit of the story about where we're at thinking about diabetes and how the Department of Health and Hospitals is trying to blaze forward at breakneck speed at really impacting not just diabetes, but of course that and other health conditions in our state. Here's what I want to do. I'll give you some statistics, a little bit boring. We'll talk about what it looks like here in Louisiana. I want you to help me think through the issue about diabetes and obesity and why we treat it differently than other conditions, and then naturally a call to action. So first, let's kind of shape up where we are as a state and our healthcare system. We didn't get to be 49th in a year. We got here over the course of many, many generations. And our healthcare system is still lagging behind what we believe our potential is. But this is a state on the move. You'll see on the left-hand side, there's Old Charity Hospital. Built in the 30s, was prepared to deliver 30-style medicine, and we were still delivering modern medicine in an old building before Katrina. We have in the center what looks like a dot matrix printer. Well, it is a dot matrix printer. Up until earlier this year, we were printing out birth certificates on it. Let's see, I'll do this. I'll just tell you what's going on. We broke ground for a new charity hospital, a new academic medical center that will bring us world-class academic medicine right down the street from where the old hospital was, and it will use modern technologies and have a payer mix that's not just for poor people. We think that both the poor and those with insurance should be treated side by side in the same facility. Our dot matrix printer, all across our department, new technologies are being introduced so we can work smarter, faster, and be more productive, and it's a lot better customer service-wise going to your parish health unit rather than to New Orleans just to get a birth certificate. Bottom center, paper records everywhere. That is the ubiquitous sight when you go to a clinic or a hospital, could be dental, otherwise, around the state. We're definitely making moves. We have Cindy Munn here that runs the organization that just Friday did a digital launch of the Louisiana Health Information Network. That will allow doctors and clinics. Yeah. See, we're not a 49th state at all. We're ahead of the pack in technology. This is one example. Then you see, what drags our ability to be able to execute on these new initiatives all the time are the things that got us where we're at, like the government owning so many institutions. On the right-hand side is an example. We owned a nursing home in New Orleans. We own several facilities. We're starting to bring these back to the private sector that runs them more efficiently and is turning out better quality measures, better efficiency measures for those that they treat and those that work there. And then lastly, for those that spend a good part of their lives in institutions, whether it's for behavioral health or developmental disability, we're giving people the opportunity to live in the community with an independent life and the supports necessary. These are the things that have happened just in the last couple of years. This is amazing, the amount of progress that we've made here. This is only one small indication of what our state is capable of doing. I always talk about spending about $7 billion in Medicaid, because I don't know anywhere else on the planet that one entity can spend $7 billion and make no one happy. Think about it. Right? We have providers in the room. No one calls me or writes me thank you cards. I love Medicaid. It's so great. Your payment rates are perfect. And people don't call me and say, I signed up for Medicaid. It was so easy and I love being on Medicaid. It's great. No, it doesn't work. We spend $7 billion. We insure about 27, 28% of everyone living in the state, and we're 49th. We're F. We're low. And I look around this room. I drive around the state. I'm in hospitals and physician offices. This is not what we are. We're not a 49th place state. We're much, much better, but we're stuck with an old system, and we're changing that system every day. Everyone knows last week we launched the name of our new managed care plan. It's called Bayou Health. Very, very exciting. We're doing something that hasn't been done before in managed care. I'll talk a little bit about the details, but we're putting responsibility shared between both the caregivers, whether it's in a pediatrician's office or in a hospital. We're sharing that responsibility with those that are on health plans, knowing that they have to attend their appointments on time. They have to take their medications adherently when they're supposed to. Prevention has to be practiced. Kids have to get immunizations and flu shots. And so do adults. I'll go over that at the end. I always want to push the flu shot. Let's talk about some really disturbing numbers. 1,400 people last year died in Louisiana from diabetes. 1,400 people, probably more, will die this year. And if we don't do anything, it'll keep going up. 1,400 turns into 1,500. Soon it's 2,000. And it's growing. And as Dr. Finau talked about, this is a fairly preventable situation if we try hard and we focus on it. This is the percent of our population that are diagnosed with diabetes. Now, there's probably some top-notch researchers in here that could tell me a little bit more about what percentage of the population likely have diabetes and are undiagnosed. Some of the national data says 3%. My suspicion is we're running a little bit higher because we're above the national average on all of our measures. It's too much. If you think about that's the number of people, almost 500,000 people with diabetes. And then here we are with 3% more that have it and are undiagnosed. And then when I go and talk in schools, and I see all the time, I could just look out and say pre-diabetic, pre-diabetic, pre-diabetic. When kids came to my house trick-or-treating, you know, I'm a generous guy. Kids, oh, you take 2, 3. But when I saw kids kind of chunky, I said, no, one piece of candy. I mean, I try to make a difference everywhere I can. Everyone called me mean, but we got to start somewhere, right? Here's where we look like against the rest of the country. Remember, the U.S. average is exactly that. That's the midpoint. You don't want to be above the midpoint. We have the football theme today. We'll just think about where we are as a team here against the rest of the pack, or the SEC. You would see the SEC would have statistics higher, not just in points scored or how many turnovers we're forcing, but what our states are in terms of diabetes and obesity. This is what we look like. Even though that last year we see a crook down a little on the data, I hope that's a trend that holds. But on the whole, that is a significant increase over a relatively short period of time since humans have been walking on the planet. The foods we eat, the conveniences that we subscribe to, the efforts that we just put off until another day, whether it's to work out or parking the car further down in the parking lot or just taking another lap around the block when we're going to walk the dog or get the mail. There are things that we could be doing every single day. And diabetes doesn't hit everyone and every population equally. Certainly worse for those that are older. You see, the left-hand chart is the incidence of diabetes. The right-hand chart, as we worry every day about healthcare disparities and health disparities, this is the percentage of people that die over 100,000. So you see that it's not something that is impacting all populations the same, and there's a spread between men and women as well. It's not cheap for anyone. So Blue Cross Blue Shield represents large and small employers by providing health insurance for a cost. That cost gets baked into premiums. I provide health insurance to a lot of people. This gets baked into tax dollars because we're not able to control how widespread this disease is and how quickly it's taking over larger portions of the population. So this is the piece that I want to really spend some time in terms of taking responsibility. I was here about a month or two ago for the Obesity Summit, and I gave a speech that really kind of turned the obesity message around. we feel like we've sort of failed. And if you look in the literature today, there's a lot about, well, obesity is something that personal responsibility can't handle. It's failed. We've tried it and it didn't work. And so now we have to do things that are regulatory. We have to go ahead and make sure we limit the amount of trans fats in this and sugary drinks for that. And there's definitely a place for thinking about how we manage and regulate what, say, is in front of our kids all the time without putting the brakes on, or what's in the grocery stores. But this is not an epidemic that we can go ahead and just change what level of shelf that certain foods are on in the grocery store. So much of diabetes we control. We control our own destiny. It's about our health. Obesity is closely linked. So what I would like people to walk away with is knowing that we own our own health and we could make a difference. Take the stairs instead of the elevator. Eat a salad instead of French fries. Eat smaller portions. Exercise every single day, even if it's just walking the dog or walking around the block. We all as a state know we need to lose weight. We're in the top 5 for the most obese states, and we're in the top 5 for the highest incidence of diabetes. If, as a people, as Louisianians, we could all come together and know we need to be healthier, we can definitely make a change.
There's a lot of positive stuff going on in Louisiana related to diabetes. Diabetes is a devastating disease, and that's the bad news. The good news is there's a lot to do to prevent it, and there's a lot to do to manage it once you have it. And I think there's probably a lot more going on both those fronts than most people in Louisiana appreciate. So the first time ever, we have federal physical activity guidelines. We've had federal dietary guidelines forever. We've had the pyramid forever. We've never had federal physical activity guidelines. CDC's got their recommendations, the Surgeon General had their recommendations, ACSM, blah, 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 blah. Those are just opinions and recommendations. Now we actually have federal guidelines, which hopefully every 4 years they're going to get renewed and voted upon, and the committee funded to rewrite them. This is a big deal. And this is, the other reason I bring this up, it's a tremendous resource. They did a fantastic job when they launched them. I want to talk a little bit about Look Ahead. Look Ahead is kind of a trial in progress, but it's a monumentally important trial. It's believe it or not, there's remarkably few studies, actually 0, which have examined whether or not weight loss actually makes you live longer. If you're overweight and you lose weight, we assume you're going to be healthier and you're going to live longer. There's remarkably few trials which have examined that. Look Ahead's going to do that in individuals with diabetes. Over 5,000 individuals randomized. You either got the intensive lifestyle, just like DPP, diet and physical activity with a goal of 7%, or you got diabetes support and education. 15 sites, Pennington's a site. In this instance, this is a hard outcome. So these people have diabetes. Now the outcome is having a heart attack or stroke. Average follow-up is going to be 13.5 years. We're currently, most participants have at least 9 years. Unfortunately, I don't have any outcome data, but you can see 2,500 people per group. Great retention. This was at 4 years. The 8-year data is actually about to come out. 90+ retention in each group. And here's the weight loss. The education group staying about flat. The lifestyle intervention, big weight loss, then slowly tapering back. This is what we see with weight loss programs, but they're maintaining it. They're maintaining a difference. So summary of the talk, small changes in diet and physical activity, which may or may not result in a little bit of weight loss, has tremendous benefit in reducing the development of diabetes. We suspect, and there's no reason to think otherwise, that these are also going to have tremendous benefits in preventing bad things from happening to you, stroke and heart attack in individuals with diabetes. And as proven by DPP and DPP-YMCA, these behaviors can be incorporated into community-based programs. Thank you guys very much. Prevention or treatment, the thing I want you to know the most is it doesn't take that much change in behavior for real positive health benefits. A little bit of change in diet, a little bit of physical activity, big health benefits.
Others have been successful in approaching this by using the resources that are out there, and truly coordination and collaboration are the key.
I think that the most important thing going forward is that we need to find those people that are at risk for developing diabetes. Like you heard multiple speakers say today, about 30 to 35% of the population have either diabetes and it's undiagnosed, or they have pre-diabetes and it's undiagnosed, meaning they don't know about it. They're just walking around living their lives, and diabetes is causing destruction in their bodies. And that is not a good thing, because we have ways to help educate these people, to get them under the right treatment regimens. As Tim Church just said, exercise, diet can make a big difference. It's probably the #1 drug to fight this epidemic. And so we really want to slow the production of this disease, reduce risk factors, get people engaged in their own health, and we can do it at the work site. We can do it, through individual websites. There's going to be a talk about text for diabetes, where you can actually get information on your smartphone. We have to think outside of the box. We have to think differently about this and apply all this great technology that's now available in our country. So once we can find those people and engage them, activate them, educate them, they can start to take better control of their own lives, their own health, more accountable, like Jack Mahoney was just talking about. For the other people that already have diabetes, we also need to focus on them as well, because as Jack Mahoney just mentioned, a lot of people are going to the doctor, they're getting their scripts, but they're not getting them filled because perhaps financial barriers, educational barriers, health IQ is not always very good in most parts of the country, not just Louisiana. So we have to work on that as well, because if we can get those people's diseases under control, we can significantly improve the quality of their life, we can make them more productive in the work site, and we can also decrease some of the costs associated with this disease. For example, in Blue Cross, which, like I said, 1.5 million members, 33% of our total healthcare spend, our premium spend, in claims that come into us, is for diabetes and diabetes-related conditions, 33%. And the population that actually have diabetes is 10%. So there's a significant cost associated with this disease that employers are bearing, that individuals are bearing, that all of us collectively as a society are bearing, and we can reduce that. So those are kind of the main things that I want people to understand, what we're trying to do here.